My name's Douglas Boyce. I'm a gastroenterologist here at Charles George VA Medical Center. With a green box, and then what that does is there's what's called a adenoma detection rate. Adenoma is a polyp that you can get in your colon. Detection rate when you go get a procedure, a colonoscopy, that person doing your procedure for you, the gastroenterologist or surgeon, should be able to detect a certain percentage of polyps. So the national standard is about 25%. So when you get a colonoscopy, that's their adenoma detection rate. So AI, what it allows you is to increase your adenoma detection rate. And for every 1% that you increase your adenoma detection rate, you decrease the chance of that patient showing up with a colon cancer by 3%. So that can be significant, and you can prevent people from developing a colon cancer from a missed lesion or maybe a polyp that you didn't see.
So it was a routine colonoscopy. It was the fact that I was of age to need a colonoscopy. So I had no symptoms whatsoever. Came in, had my colonoscopy, woke up and informed by the doctor that I had colon cancer and that I had two very large tumors, one towards the top of my large intestine and one towards the bottom of my large intestine.
The guidelines now are for patients age 45 to 49 to come in for a screening colonoscopy. So average risk patients, as part of their routine health maintenance, that should be the starting point. Previously it was age 50, it's back down to age 45 now, just because they've shown you're seeing an increased incidence of colon cancer in younger people now, so they've kind of shifted that to the left a bit. Once you get a colonoscopy, depending on your risk and what they find, that dictates how often you get a colonoscopy thereafter. And some folks, they continue that until they're 75, 85. It depends on their functional status and what they wish to do as well.
I had no symptoms. That's the biggest question that people ask me is, what symptoms did you have? I didn't have any symptoms.
The biggest risk is age. So as you get older, the incidence of colon cancer goes up dramatically after the age of 50, and actually that's what that graph shows on the computer here. So age is probably the biggest risk factor for folks, and then also family history. If there's a family history of colon cancer or polyps, that increases the patient's risk as well.
They saved my life. The VA saved my life. I would not want to get my care anywhere else. I had to have the experience inside the VA and outside the VA, and my team inside the VA is a blessing. They all work together, from my primary care doctor to my oncologist to whole health to dietitian, nutrition, my GI doctor, Dr. Boyce, and his nursing staff. They're outstanding, and I am truly blessed to have the VA, and I would not want my care anywhere else. They go above and beyond routinely to make sure I'm taken care of, and they're a real blessing, and I wouldn't want to trade it for anything.